Hello friends, I'm here to talk about care coordination today. According to Davis, back in 2020, continuity of care is seen as important to high-level healthcare and shows a person's experience of coherence, connection, and consistency of care delivered over time. I don't know how many of you have been through the healthcare system as a patient, but let me tell you about the experience of an average person. Most times, there's this thing that happens to you, usually unexpected. You spend some time in the hospital. Could be a long time, could be a few days. This time is probably the worst time of your life. You have a very little understanding of what is happening next. Your roadmap is usually given to you right before things are going to happen. Sometimes things happen unexpectedly, and not only is this the worst time of your life, it is the most unpredictable time of your life. Things happen that can set you back. Sometimes there is little or no progress. Your confidence goes up, your confidence goes down. You hear from your nurse that your discharge might come up soon, and you're overcome with these different emotions. You're happy that you get to go home because you've been in this new, different environment for a while, and you've been missing home. But you're nervous about going home. You wonder how you'll take care of yourself. What about doctor's appointments? What about medications? Wasn't I supposed to call another doctor? There's always these questions that you don't have the answer to, and you're a little scared to ask because you don't want to seem as if you don't know what's happening. You don't want to ask questions because you don't want to take in even more information that you might have to ask about. You wish you could snap your fingers and have everything happen without having to leave your couch. So I guess the one problem that we need to address is, as a health care provider, how do we best affect our patients positively during care coordination? Effective communication is a hallmark of care coordination and cannot be compromised. Poor communication among healthcare providers and lack of shared information about patients result in undertreatment, suboptimal therapy, adverse drug events, and hospital admissions or readmissions. This is according to Levitt, Ballo, Nass, and Gans in 2013, as cited in Swan, Conway Phillips et al. In 2019. Almost a half of patients have at least one medical error after being discharged, and 20% of hospital patients have an adverse event after discharge. This is according to Swan, Conway Phillips et al. In 2019. Another effective strategy is empowering the patient and having them take more of a central role in their healthcare management. The mood conveyed in published works points to enhancing self-care management and collaboration on decision-making, supporting improved health outcomes and care experiences. This is according to Swan, Haas, and Jesse in 2019. If care coordination goes the way we all would like it to, then hypothetically speaking, our capacity for managing change shouldn't be a factor. Going through transition from the ER to having labs done, then having other diagnostic procedures done, and subsequently getting a bed on a medical floor and going through treatment would be like a softened blow, because as patients we'd be more informed, and so the different happenings of the patient care experience would be more digestible, because if care coordination is taking place effectively, then communication of what's happening is also taking place. As far as the first stage, there's less shock and denial if the patient is informed, and those lines of communication are open. The second stage, impending anger and fear, is minimized, hopefully. Change is still the unpredictable entity, and maybe to a lesser degree, but still unpredictable. After this stage, exploration comes next. Dealing with change is applied to high-quality, patient-centered care, and it's easier to deal with. Finding out about the treatment and how it's going to progress is a welcome feeling for anyone that is going through the healthcare system. In the final stage, the patient is more comfortable with what is happening as far as their treatment. They're more confident and ready to go through whatever is in store for them along their journey in the healthcare system. The subject of ethics would still be a question, perhaps even more so. There are more providers involved regarding HIPAA, for instance, protection of patient health information is still paramount, and care has to be taken when communicating patient information so the wrong entities do not end up with information they're not supposed to have. The rationale is the same as it would be anywhere else. Patient and PHI are still to be protected. Patient rights are still to be respected as they would be otherwise. The Office of Civil Rights is looking to scale back HIPAA regulations that they can protect patient data but still allow the fluid exchange of information between entities. This is according to HHS Seeks Public in 2019. As nurses, when applying patient-centered care to care coordination, it is a necessary enhancement and is a relevant part of any care plan. This is the only way it can be at its most effective. While we're not in the image of Florence Nightingale, at least we're not all in the image of Florence Nightingale, we are in a tremendous position. We stand at the intersection of where the patient realizes they're probably going to be here for a while. We're the ones who review their orders because we're going to be the ones who have something to do with so many of them. Throughout that patient's journey through healthcare, they're going to see many of us. No, we're not in charge, but I know a few of you who think you should be. Let's take our place in this initiative. Are you tired of seeing the patient that we just sent home? They're back so soon. They're still wearing the same wristband they left just a few days ago. Are you just a little frustrated that same diabetic patient came back for another foot ulcer on the same foot? Imagine if they had known what to do. Imagine if we would make sure that they didn't come back. I'd rather see my patients at the supermarket, not here. At least not inside of 30 days. I'd rather see my patients out and about. Maybe talk about how they remember bedpans and catheters. I'd like them to offer to show me the surgery scar only so I can refuse. At least I know it healed, right? Don't you remember the patient who was ready to go home yet wasn't confident about that next step? We read them the discharge instructions over and over and highlighted all the important information. We saw that worried look in their eyes and we hoped that they were going to be okay. We wish we could have a do-over, maybe do something that would make a difference, something that would change the outcome, something that would make it all good. We're nurses. We see these people on the worst days of their lives. We see them hopefully on a happier day than when they arrive. We would like it if they came and did what they were supposed to do, while we did what we were supposed to do, and have everything go the way it ought to go. It never does. So we hope things work out well. What if we could do something to make it happen? It's always nice to get a positive outcome. All the patient teachings stick, discharge instructions are followed, and they see the doctor that they're referred to, and to put the topping on the cake, they show up in 2 weeks for their follow-up appointment. My fellow nurses, let's see our patients all the way through to recovery as best we can. While they're with us, let's protect them. Let's treat them with compassion. Let's advocate for them. Let's do all things right concerning ourselves and our patients and remain professional. Protect their rights and health information and empower them with the confidence to decide about their treatment and take care of themselves where necessary. Let's do what it is we came into this job field, and take care of people in the system and making them well. My friends, you took a step coming here and let me speak to you today. I implore you, take another step and join me in enriching lives. Thank you for your time and have a good day.